Remember that physical health is the concept we think of most when talking about health. There are 6 other elements that need to be incorporated to achieve absolute health. They are social health, spiritual health, emotional health, intellectual health, vocational health, and global health. We will be focusing this lecture series on the keys to physical health for now, as they seem to be the most time-consuming, most difficult to understand, and the most costly if ignored. As you should recall, they are dietary modification, global elimination of toxicity, supplementation, reduction of stress, lifestyle modification, and exercise for health. Integration of these keys is a very important concept to understand. Each key is singularly important and must be understood and practiced. No one key is any more important than any other. All are equally important and must be equally understood and achieved in order to reach the goal of absolute health. Healthcare providers rarely focus on all. They are specialized to focus on the intervention phase of sometimes only one of the keys, and sometimes only one part of one key. This is understandable because of the training required to be very good at intervention. There are some providers who focus on combinations of several keys. For example, it is common to hear about what is called holistic medicine, where the combination of eating and detox are the only keys generally considered. When the absence of a disease is the goal, the focus may be on only one or two of these keys, if at all. When health is the goal, all keys must be the focus. Most efforts in healthcare are based on the advent of symptoms. These are generally brought to the attention of the patient in the form of pain or major dysfunction. We need to understand, however, that a symptom or a pain is not the problem. It is or may be a signal of the problem. Dysfunction may show itself quickly, such as when an injury or accident takes place and some tissue is torn or broken. This kind of occurrence may be the problem, and the pain or symptom may show up simultaneously. Or it may show up after years of endurance of stress, such as a stomach ulcer that gradually appears in the lining of the gut after slowly wearing away of the surface tissue, possibly as a result of storage of internal stress, or a continual diet of harmful food, or the lack of immune response to the invasion or breakdown, or the loss of stimulation of the nerve components of any combination of these, or a simple running injury. Traditional medicine has become extremely focused on testing the function of related systems of the body through blood tests, imaging, and other functional tests, but these do not necessarily relate to the status of one's health. Therein lies a major problem. Our focus here will be to first determine your actual physical health status. We have a number of tools we use to do that. If serious items are discovered or life-threatening situations with your current physiology, we may perform interventions here, or we may refer you to other doctors. When radical interventions are not indicated, we will proceed to alter your current habits for health. By now, you should have set up an appointment.